DiTA is the Diagnostics and Technology Accelerator. It's an initiative led by Manchester University NHS Foundation Trust, and our aim is to work with industry to catalyse the generation of research evidence for new medical technologies, and within that we would incorporate both in vitro diagnostics and new medtech. It's really important that we work closely with industry in partnership so that we can allow our patients to benefit quicker from new technologies to give them the maximum benefit.
What sets DiTA apart from other generation networks is the ecosystem in which it's delivered. Health Innovation Manchester is an organisation which works at city region level to drive rapid innovation towards the population of 2.8 million people. DiTA is a really important part of that, because by working really carefully with the great leadership and organisation of MFT and their excellent specialist services, we have a real rich point of the pipeline where we can evaluate, develop new value propositions, which we can then rapidly scale out for citizen benefit, both in Greater Manchester and nationally.
We've worked with Rick Body on a couple of projects, and high sensitive troponin for our global organisation was a key project to develop research and information to help us accelerate the adoption of the product.
I think DiTA has made it clear that they can support very practically small companies. They have access to an entire care pathway, a health ecosystem, and then they have very particular expertise around in vitro diagnostics, its evaluation and preparing business cases for adoption. So I think that's how they're going to help, very practical support and help to these companies.
North's health science economy is worth over about 17 billion across 1,000 companies employing 49,000 people. Many of those people work in medtech and in vitro diagnostics companies. It's a big strength of the north of England. And they need to find ways to test, evaluate and adopt their technologies within the NHS. DiTA offers an opportunity to streamline that process, to be able to talk to regulators, to be able to talk to the NHS, understand how a technology fits within the context of a pathway. And by leveraging the other infrastructure across the north, whether it's in Newcastle, Liverpool, Sheffield or York, alongside DiTA, it means companies can come here to Greater Manchester, work across this patch and then scale across the north. And that growth is really important to small startup companies that often IVD and medtech companies are.